Which of the following is not true about Amsel's criteria? A. Excessive vaginal discharge. B. pH less than 4.5. C. Fishy odor after adding potassium hydroxide. Or D. Presence of clue cells. In today's class, we'll learn the correct answer and a lot about this topic. Hello everyone, welcome back to my class. Today's class is on bacterial vaginosis, and it is in clear terms not an STD, but it is a sexually associated condition. That means it is seen more commonly in females who are sexually active. Bacterial vaginosis has many synonyms as written in the box. If we want to define it, bacterial vaginosis is a polymicrobial syndrome which represents a disturbance in the vaginal ecosystem. That is, the normal vaginal flora, which is predominantly lactobacillus, is replaced by anaerobic bacteria and mycoplasma. It was Gardner and understand what is the disturbance in vaginal ecosystem. Under the first, term, we need to understand what is vaginitis, vaginal ecosystem. So there are three stages in a woman's life. The reproductive age, and before that is the premenarchal age. After that is the menopausal age. At birth, vagina of a female baby is sterile. Under the influence of maternal estrogens, this change attracts the lactobacilli to colonize in the vagina of the baby. So the vagina of an infant girl also is interspersed by Coagulus negative staph, Streptococcus and E. coli along with other intestinal bacteria. The pH of premenarchal girls is neutral. In reproductive age, when the girl enters menarche, estrogen production is increased rapidly. Vaginal epithelium matures, that means it becomes thick, round about 25 cell thick and glycogen rich. Vaginal epithelium is shed time to time, and the glycogen in the shed vaginal epithelium is broken down into glucose and maltose by the host enzyme like alpha amylase. Now this glucose and maltose are substrates for the lactobacilli. They convert them into lactic acid. Now this lactic acid changes the pH of the vagina of an adult female into acidic environment. The pH becomes less than 4.5. This acidity or the acidic environment protects the vagina from the pathogenic bacteria. Now what happens in menopause? There is estrogen withdrawal, vaginal epithelium atrophies, glycogen storage decreases, thus there is less of lactobacilli in menopausal vagina. Thus the pH turns a bit alkaline, it is more than 5. After understanding what is normal, it is easier to understand the etiopathogenesis of bacterial vaginosis. In an adult female of reproductive age group, there are some risk factors which predisposes this female to bacterial vaginosis. They are IUCD insertion, early first intercourse, multiple partners, increased age, years of marriage, parity more than 2, history of STD, and others like uneducation, low socioeconomic conditions, smoking, douching, and using bitted toilets. We have even heard lesbians have a higher risk in one study. It may be due to the sharing of toys among them. Due to these risk factors, a normal vaginal lactobacilli is replaced by a polymicrobial ecosystem which contains of anaerobic bacteria and mycoplasmas, which are Gardnerella, Mobiluncus, Prevotella, Mycoplasma, Peptostreptococcus, Porphyromonas, Bacteroides ureolyticus, and others like Corynebacterium, Staph, which is coagulase negative, Streptococcus and E. coli. Now this was the qualitative change in the microbial ecosystem. There is also quantitative change, that means the bacterial load in vagina increases to about 1000 times the normal. The third is the lactobacilli, which are hydrogen peroxide negative, that means they can't produce it, predominates. Fourth point is that there is inadequate IgA secretion in the host. So this encourages or makes it easy for the pathogenic bacteria to invade. Fifth point is that the vaginal mucin is broken down by the enzymes like sialidase and peptidase, which are produced by Gardnerella, Mobiluncus and Prevotella, and this helps in the adhesion of the pathogenic bacteria. All this together leads to a condition known as bacterial vaginosis. Moving on to the clinical features, there is excessive vaginal discharge, which is foul smelling. There can be associated itch, dyspareunia or abdominal pain as well. Now this is a picture which shows the vaginal discharge of bacterial vaginosis. It is foul smelling, thin, grayish white, homogeneous discharge, and it smoothly coats the vaginal surface of the patient. Now, how to diagnose this condition? There is a very famous Amsel's criteria for bacterial vaginosis, and it is the gold standard for this condition. There are 4 criteria. The first one is excessive vaginal discharge. The second criteria is that the vaginal pH should be more than 4.5. Normally it is acidic. It becomes a bit alkaline in BV. We take a litmus paper of narrow range pH like 4 to 5.5 and apply it to a withdrawn speculum from vagina, and it will show the pH, which will be a slightly alkaline. pH more than 5.5 indicates cervical secretions. The third criteria is amine test or whiff test should be positive. Here what we do, in the vaginal secretion we add 10% KOH, and the smell is very distinct. It is fishy odor. The reason behind this fishy odor is that vaginal secretion contains vaginal epithelium which is shed regularly. The proteins of this epithelium is broken down by peptidase and sialidase of the Gardnerella, Mobiluncus and Prevotella like bacteria into amino acids, which then is converted by an enzyme decarboxylase produced by anaerobic bacteria into amines, namely trimethylamine, putrescine and cadaverine, and these amines have a very distinct fishy odor. The KOH adders lyse the vaginal epithelium, thus enhancing the reaction and gives a stronger smell. The fourth criteria is the detection of clue cells in wet mount or in gram staining. What are clue cells? These are vaginal epithelial cells which are studded by bacteria on the surface. So this is the shed vaginal epithelium studded by the bacteria, and it looks like this under the microscope. So Amsel's criteria has 4 criteria, 3 out of which should be fulfilled to diagnose as bacterial vaginosis. Apart from Amsel's criteria, there are some scoring systems, one of which is Nugent scoring. Here we take the gram stained vaginal smears and we count each bacteria, Lactobacilli, Gardnerella and Mobiluncus. So we'll count each bacteria under oil immersion field and we score them. Per field, if it is less than 1, score will be +1. If it is 1 to 5, +2. +3 if it is 6 to 30 and +4 if it is more than 30. We will understand with an example. First, we take lactobacilli and see how many are there. If it is more than 30, the number here is +4. And in this chart, 4 lies under 0 score. So we'll record 0 for lactobacilli. If we take Gardnerella and it is 6 to 30 per immersion field, the corresponding number is 3, and we will look here, 3 is under +3. So score for Gardnerella is 3. And for Mobiluncus, if it is 1 to 5 per field, the +2 in this chart is under +2. So we'll add 2 for Mobiluncus, final score will be 5. Now the scoring system here, the chart says 0 to 3 is normal, 4 to 5 is intermediate, and 7 to 10 is bacterial vaginosis. 5 corresponds to intermediate, that means we need to repeat the test. This was Nugent scoring. There are some other scoring like Hay or Eisen system where the percentage of bacteria is taken into account. There is also Smith's criteria and some other tests like succinate lactate ratio, proline amine peptidase test, and simple amine test or gram staining. Some sentences about bacterial vaginosis and pregnancy. It may result in late miscarriages, preterm delivery, premature rupture membrane, endometritis, chorioamnionitis, or PID. Bacterial vaginosis and HIV. The following mechanisms help in HIV infection. Hydrogen peroxide produced by lactobacilli is toxic to HIV virus. So in bacterial vaginosis, this is lacking. This helps in the establishment of HIV infection. The acidity of lactobacilli is also inhibitory to CD4 activation. So this is also lacking in BV. Mucin is degraded in BV, which leads to increased adhesion of the virus in the genitalia. Number 4. Increased interleukin 10 in vagina increases the susceptibility of macrophages to HIV. These are the mechanisms which helps HIV infection in bacterial vaginosis. Now moving on to the treatment for bacterial vaginosis. Treatment is recommended in women with symptoms. The recommended regimens are metronidazole 500 mg twice daily for 7 days, or metronidazole gel 0.75% 5 gram intravaginally once a day for 5 days, or clindamycin 2% cream 5 gram intravaginally at bedtime for 7 days. Some alternative regimens: clindamycin 300 mg twice daily for 7 days, or clindamycin ovules 100 mg intravaginally once at bedtime for 3 days, or sacnidazole 2 gram oral granules in a single dose, or tinidazole 2 gram oral once daily for 2 days, or tinidazole if 1 gram it gives once daily for 5 days. Clindamycin intravaginal ovules have an oily base that might weaken the latex or rubber product, so condoms or diaphragm might rupture, so the use is avoided for 72 hours. But below it is written to be avoided for 5 days, so we'll take the higher number, avoid for 5 days. Women are advised abstinence or use of correct barrier method during the treatment. All patients should be screened for HIV and other STIs. Follow-up is not necessary in BV. The routine treatment of partners is not recommended at present, but there was one pilot study which showed that if the male partner is also treated, the vaginal ecosystem of the female partner was more normal and stable for a longer period of time. Prefer clindamycin cream if there is allergy to metronidazole or trinidazole. Pregnancy symptomatic women are treated, and HIV same regimen is followed. Coming back to the question we started, not true about Amsel's criteria. Excessive vaginal discharge is true, fishy odor is true, and Clusels is also true. pH should be slightly alkaline, that is more than 4.5 in bacterial vaginosis. So answer is B, pH less than 4.5, which is not true in Amsel's criteria. This brings us to the end of today's class. There are many other topics discussed in the channel. If it helps you, please subscribe, and we'll meet with a new topic in the next class.